Our breaking news this morning on the agenda is watch the third confirmed case of COVID-19 in South Africa. I want to bring in the Health Minister, Dr. Zweli Mkhize. He's on the line to us. Dr. Mkhize, thank you very much indeed for coming through. Tell us more. The third case confirmed in South Africa.
Yes, that is correct. We'd like to announce that a third person has been tested positive for the COVID-19 virus. This is a person who's part of the group that was kept on surveillance, the 10 people that had traveled together to Italy. She is a contact of the first patient and is actually the wife. And so she has been tested and the result come back positive. But she has no symptoms and she is well. The children were also tested and they are well, but they have tested negative. But because of the fact that their parents have tested positive, they will stay out of school. We would like to keep them as long as their parents are positive. Then when the parents have changed to become negative, we will then test them to be sure that they also are free of the virus. The patient, therefore, will be taken for assessment, examination by the doctors. They will then decide on the course of action, how to deal with the patient, how to treat the patient, and so on.
Right. Dr. Mkhize, this is very interesting because you say that the wife of the patient, the first person that was tested for COVID-19, doesn't show any signs or symptoms at this stage, but she is positive. What's further interesting is that the children tested negative. Explain the signs to us.
Okay, firstly, we're not surprised with any of these that you are finding. We expected these results. Firstly, the husband, who is the first patient, was exposed to the same conditions that gave him the infection. The chances were the wife was going to be positive as well because they were together all the way. They've been to the same area where they were exposed similarly to the infection. Secondly, once he is positive, it's very much likely that the wife will be positive. But the duration of their contact with their children was not expected that by now it would have converted the children to be positive because there's still going to be an incubation period and so on. So we didn't think the children would be infective to other people, as it were. However, because they are together with them, they have to be checked because any time during this period, they could in fact contract the virus and therefore their body will display a positive test to the virus. That's why we'll keep them like that.
Right.
Now, the interesting thing is any one virus does not affect people the same way. It depends on many issues. One, depends on how much the dosage of the virus that the person is exposed to. Those who get exposed to a lot of viruses and those who get exposed to less viruses will not respond the same. Those who exposed earlier, maybe they won't respond to the same way as those who get exposed later.
Right.
And those who have a particular underlying condition will actually find that they have a bigger problem than those who don't. So people don't respond the same. So there's nothing surprising at the moment. And so we must also expect that people won't be the same.
Right.
When you look at the reports, for example, take an example from China, they'll give you a list of 80,000 people who have been affected by the virus. Unfortunately, 3,000 of them passed away. 53,000 have been cured of the virus. Doesn't mean that all of them were necessarily sick, very sick. But then of those who are positive and still on treatment, then there are two groups. There are those who are mildly or who have mild symptoms or no symptoms. There are those who need intensive care. Those are the categories of how you deal with it. So you should expect them to fall into any of those categories. But I think it's important. Later on in the afternoon, we'll have time to demystify the infection so that people must just understand we can contain this issue.
I know you have to go, Dr. Mkhize, but I just want to hold you for just a bit. I just want to understand this, and especially for our viewers at home to understand this. The incubation period, the quarantine period is between 1 and 14 days. When the people coming from Wuhan, I know you're going to put them in for about 21 days. But I'll get back to the children, which is very interesting. Do we know exactly when they contracted, I'm talking about the parent, the father, when he contracted the virus in Italy. We know that they came back at the beginning of this month, and it's just now, the 8th. So we're still in that incubation period. So are you going to keep a close eye? There's a possibility that they might test positive at the end of 14 days, correct?
Yes, it's very difficult to know when somebody gets exposed to the virus and when it starts infecting them.
Right.
So the parents, we can say, they came back on the 1st. So they would have then been infected before the 1st. Whether it was 2 days or 14 days
Correct.
or 10 days, it's very difficult to say. What we know about the virus is that anything between 2 and 14 days, it can actually it can lie dormant and then show symptoms anytime after 2 days or after 14 days. So when we deal with the issue of quarantine, we deal with the possible average duration of what that could be. There is possible that other people can be a bit longer or even shorter, but these are the average days that we're working on, and we use that to guide the approach to quarantine.
Could you tell us when the person that contracted this virus first, the first person that contracted COVID-19, he returned on the 1st, you say, of March. Do we know his movements from the 1st of March when he returned to South Africa?
By the way, we don't know if he was the first one to contract the virus. We only know that he was the first one to test positive.
Okay.
That's because of the whole area there is a little difficult to be very precise about it. We do know the movements from the time they left the province of Milan, the town of Livigno, and so we have all those details right up until today.
Right. What I'm trying to figure out, Dr. Mkhize, is that from Dubai, we understand, since you gave us some more insight in terms of his travel path, he went from Dubai to King Shaka Strait. From King Shaka, did he go anywhere else besides home? This is what I'm trying to get at.
Okay. Let's put it this way. We have ascertained who the people are that would have gotten in contact with the first patient since he got from the plane from Dubai up to the time he went to the doctor. Mm-hmm. We've got that whole list together.
Okay.
So those who were in the plane, we have actually picked up the information from the aircraft. We are tracing them all, and those who were met outside the plane from airport to the house, and after he was in the house, we've got that whole list. So we're tracing all of them together.
All right. And we understand that the other group, the 6 group members who traveled to Italy we're expecting those results within 48 hours, correct?
That's correct. That's correct. In 48 hours, we'll have got all the results of everyone who was in the group of 10.
All right.
At least 9 of them, because one is not inside South Africa.
Okay. Dr. Mkhize, I know you have to leave, but I just want to sneak in this one question because, when you look at social media, you get a distinct feeling that people think that once you contract this virus, game over, you're going to die. I want you to break down some of the myths. Is this an existential threat facing mankind? I want you to put this virus into context for us.
I think to give it a better context is that of the 80,000 people that were diagnosed in China, the almost 77,000 are with us. That's about 3,000 passed away. This was mainly in the early days when the disease was not well understood and people were having other illnesses and they were in hospital, they were sick, and then they got co-infection and so on, and nobody knew how to deal with it. Yeah. Since then, more people have recovered than those who are still sick.
All right, Dr. Mkhize, thank you very much indeed for sticking around and giving us more insight about this case. So no doubt we'll hear more from Dr. Zweli Mkhize, Health Minister, a little later on.